but for a robot, it can do 720, and it really can come to a really narrow place, and also it's not shaking for robot, and also the pictures, actually the image is so clear. It also can replace the hands to finish the whole operation. I believe this really delivers the benefit to the patient. So the Chinese PLA General Hospital started from 2017, we started to have this robot, and until now we have around 7 surgery robots to help us to do all the operations, and especially for the thoracic surgery department, the robots actually help us to do a lot of operations, more than 100 operations, especially like the esophageal surgery. We talk about the mediastinum. Actually, and also we talk about the robots. We still have time to get used to it. We also need to know what kind of the patient can do these kind of the robots, and it's really good to let the robots really deliver the actual benefit, make the impossible possible. I believe this is what we want to achieve for the patients from the PLA and also from the local places to really enjoy the benefits brought by the robot. Thank you very much. Thank you. And let me give our viewers a little bit closer look at this surgical robot, how it works. And right now we are operating a robot. It's like an Iron Man, but we talk about this really through a hole. So we bring the arm inside the body, and we talk, this is really precise operation. It's really accurate, and as we said, in the very narrow places, sometimes the hand really cannot reach there, but the robot can. So this is really bring additional benefit to our patient. All right, we are right now in the operation room of the thoracic surgery department. This is really cutting-edge technology, help the benefit. Actually, this is not the only robots they own. Actually, we also look at their video. They also use the AI to help them to empower the operation. Let me show you a video clip. So right now they are looking at, this is the lower right lobe. So they are using the VR to look at the organs. So these visceral organs actually represented with VR. You can see this is the cutting-edge technology to help the doctors doing their operation. And right now they are talking about the lower right lung lobe resection surgery. And they are right now doing the plan before the surgery. So they also talk about adaptation disease. So, and they also use these kind of the tools by VR. So they look at the how to deal with the artery, veins, and also how to really do the whole route. Basically, they will have that rehearsal of the whole operation, which step to go first, which step to go next. And they will look at the which artery or vein we should cut, and we should cut like VRA and keep VRC. So this is the whole plan. They are talking about the lower right lung lobe resection. So by the help of VR, they can have a quite a clearer picture in mind. And you also look at right now, this is during operation with this imaging. You can see exactly how the operation or the organ should look like, and also the plan of the operation. This is all represented by VR. So look at this is the residual part. And this also can show you clearly the artery, the vein. And you also look at this is the bronchus. Right now they also discuss about the operation. So VRA and VRC help them to make the decision. So right now they are doing the plan. This is the resection operation. So they are discussing the plan based on VR image. So they are talking about the upper right lung lobe. So we can know exactly the edge. So they know exactly where to cut, or that's very important for the resection operation. So just now we observed the operation delivered by the or thoracic surgery department, and that's also with the help of the surgical robot. And we also right now to another department. This is the radiotherapy department, and my name is Cai Boning, and we have 4 rooms. Actually, inside this room, that's our secrets, our equipment. And we also have the like nurses, the doctors. Actually, we all have our office on the other side. So right now, in front of the radiotherapy department. So we talk about the radiation for many times. So because the door closed, we still have the radiative substance. We are quite safe here. The level of radiation a little bit higher, but actually based on the detections, we are quite safe. So we talk about X-ray, CT image. Actually, all can called as X-ray. So that X-ray or the array we use is quite low level of radiation. We not use that high level radiation. But we talk about the radiotherapy actually use quite a very high level strong radio isotope. So this is the room number 1. This is for the radiotherapy. Let's look at this equipment. That's for the quite normal practice. And now inside we are delivering a therapy, the blue part. Actually, the blue part is moving, and also in the middle part, that's the tumor part, and that part also is changing. And make sure the dose we give is quite a matching with the tumor. Actually, we talk about precise radiotherapy. Basically, that is what we give to the patient should be equal with the size of their tumor. So you can hear the sound. Actually, that's a sound made by the ray. So we talk about the radiotherapy. We know the Superman. Still, we rely on this equipment. The equipment produce ray, and that ray actually help us to cure the tumor. So of course, that ray is calculated by the equipment. How many equipment we own? We have 4 equipment here. That's for the normal radiotherapy, and we also have another one actually I will show you later that have the specific purpose. for this specific disease. So do we have other equipment? Actually, talk about these four kinds of equipment. More is quite larger size, but they are actually so different. Of course, they are all cutting-edge technologies. So what does that mean for patient? So a lot of patients come to me to say whether I use the best one. Actually, there is no best or good or bad one. Actually, we own all the cutting-edge technology. What we gave to our patient is designated therapy that's designed for that patient, for his or her disease. And let's go to another room. We talk about the Cyberknife equipment. We talk about Cyberknife. Why we give it a different name? Actually, here is quite a normal tumor that's for the quite a general radiotherapy, so that will all receive the treatment here. And we talk about that the Cyberknife that really help to produce ray to a smaller area. So basically, that's what we call knife. So you will very soon see the Cyberknife. We have knife for sure. So, but for the surgery department, they use like the scalpel. But for us, we are from the radiotherapy department, so these kind of equipment we call the Cyberknife. That is our knife, our lancet. So right now, coming to our cyber room. This is the Cyberknife operation room. So this is Professor Tu. So would you please introduce a little bit about this cutting-edge technology, the Cyberknife? So welcome to Chinese PLA General Hospital. This is the radiotherapy department. I believe just now you observed the scalpel used by the surgery department. And right now you are looking at this is Cyberknife. So this is we use the technology. So we had the help from the computers. This is also can consider as a robot. So from the screen, this is a robot arm. And also with the drainage, and also with the bed, and also with the image transmitter, all these together, we call it the equipment of Cyberknife. So talk about this equipment because we just saw one equipment. So just now you see the equipment that's quite normal. We talk about the irregular radiotherapy that can change the dose, can change the level of power, and actually this is more for the precise the technology. This is actually called the SRT. That's basically for the smaller size of tumor, and this is really deliver a great benefit to our patient. So talk about the SRT. That's a stereotactic radiotherapy treatment. So this technology, I believe, we look at the domestically and internationally. This is always leading the whole industry. So you can see right now our radiologist is operating through this computer. So what they are doing, they are positioning the tumor. So we talk about this can provide the image. This is the real-time tracing. Only Cyberknife can achieve this. We talk about actually at a lung cancer patient because the whole process needs 1 hour or an hour and a half. So we talk about the tumor. Actually, the cancer cell move with the lung. So before, we not really have these precise tools. If we use the radiotherapy, actually, that's really a big impact to the lung. So right now, they are doing, our radiologists doing is give you a simulation. We talk about if a cancer is moving dramatically, how the machine will work. Because right now, you can see the Cyberknife actually can move with the move of tumor. So that basically lower the impact to the normal organ or the normal cell. So let's go inside the room of the operation. So this is operating room. You can see before we give the treatment to the patient, we need to have this real-time verification process. So we look at also calculate the DA precision level. So basically your brace, a lot of things are moving. Look at what we call it the machine head. And this one you can see is actually moving. So this is basically tracing the tumor. So you can see it's changing all the time. Only Cyberknife machine can achieve this. This is its unique function. So we talk about a tumor in the heart, and the liver, spleen, lung, kidney. If we talk about, actually, you can see the bigger movement of the cancer or the tumor, the better treatment this cyber machine can deliver. So you can see this is really doing the tracing therapy. You can see the red dot. This basically gives you a sense that this is a simulation of a tumor. The technology basically is in response to the need, especially for the patient. They're quite practical issues. So basically, this machine helps to lower the error, especially to the chest. Because for patients, if they're lying down on the bed, still they will move a little bit. Sometimes the normal machines cannot really give that a precise treatment. For the tumor, if they are locating in lung or kidney, so this is really good to treat this kind of DA tumor. And we talk about the DA patient with the early stage of lung cancer. They don't want to receive DA treatment, or the patient that after operation, we talk about hope this Cyberknife machine can give them help. And actually, we hope the treatment can deliver the same effect as the real surgery with the real knife in thoracic surgery department. And we look at these small modules, what they are doing. So you can see we have the smallest to the largest one. For the smallest one is 5 centimeters, the millimeters. So we talk about this is a robot. Actually, we will choose different size of the head. This is basically the one produce ray. So the machine, very smart to know exactly what the size of the ray producer it needs. It needs 5 centimeter or 5 millimeter. The machine will decide by itself. Of course, tumor is like a glass ball. So no tumor is with this very nice shape because you cannot cave it. So the machine needs a different size of the ray producer to kill all the tumors. So we talk about we need to first get the edge of the tumor. So make sure when we're doing the equipment, doing the operation, it will not bring the impact to the healthy organs. So for this machine, you just, like for some tumors, you just receive one treatment. And for others, like the maximum is 5 times. So why this machine can make it? Because it's quite precise, it's very precise and very accurate. And because of they are so accurate, so you are there to increase the dose. So we talk about Cyberknife first. It should be very accurate, precise. So talk about the Chinese PLA General Hospital. So we have quite elder age patients, like in their 80s, 90s, or even 100. So for them with early stage of lung cancer, if their physical condition is not allowed them to receive operation, or they're not really willing to receive operation. So this Cyberknife did a lot of cases to this kind of patients. So we can tell in our previous 3 years experience, the treatment given by this Cyberknife actually can reach the effect given by the operation. So we talk about the temperature actually is quite low, right? So we talk about the temperature is always keep at the same. So the equipment actually have a quite higher requirement on the temperature and also the humidity. So humidity and temperatures have a higher requirement because of this machine should provide a very precise treatment. And we talk about the module at the back. They are designated to different patients. For our patient, they need to lie down here for at least a half an hour to 1 hour. So for each patient, we need to give them a customized this is the coatings or these kind of clothes we use. So this is the customized for our patients, and of course it also limit their movement. And for this kind of equipment, it also can recycle and reuse. So we use Cyberknife, and this is something we put on this bed. If you go to other rooms, they may have other equipment or the other ways. For this, it's only for the Cyberknife equipment. So you look at the different blue, that's basically to different patient. So this is very environmental friendly. This is a quite a large giant. So talk about our radiologists. What's the job we are doing to make sure the machine operates in a designed way? So talk about radiotherapy department is very professional. It requires our radiologists and technicians and our nurses and also our nurse practitioners to work together. So like a radiologist, like the commander. So he is the person to decide which patient is good to receive the operation given by the Cyberknife. And we talk about the exactly how to design the plan. We will have the practitioners to discuss with the radiologist to see whether you look at the plan is good or not. And then our technicians will help us to do the execution part. So you look at the one machine, actually, there are at least 4 persons involved. Quite complicated. So talk about radiotherapy department. We kind of have quite a complex process and have more people involved. This is a little bit different from thoracic surgery department. You look at actually we talk about these physics. So you think about why we need physics here, because they are not really have that the doctoral scientifications. Actually, this is a little bit quite a unique part. So this is something we really let our viewers know exactly. This is something different from other clinic department. So this afternoon we show you a little bit tour in the 2 departments of Chinese PLA General Hospital. We look at this real physical lancet that's give the operation given by the thoracic surgery department. So at the very beginning, that only can give the operation with this kind of the scalpel, and then we see right now they're also using the surgical operation to a very precise narrow space, and then we come to the radiotherapy department that involve a lot of people behind. This is actually we talk about Cyberknife. It's a virtual knife, but that's also give a precise treatment to our patients. Actually, we united as one team to help our patient fight against the cancer, fight against the disease. We talk about doctors. Actually, that's the way we talk about operation. No matter how technology developed, still behind the technology, we should see how hard our doctors work, because they really take our patient into their consideration. In the end, that's the communication operation. What is operation? That's a communication between the doctors and the patients.